So it's 2 o'clock. We'll start. Okay. So welcome, everybody. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, email address in the chat box. Okay. Include names of the companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. Show your face during the picture. Reminder, take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate. I have placed the link in the Facebook page and the Viber group. Later on, I will paste the link in the chat box. So down below is the picture of the certificate that will be given to those who will get a perfect score on OLETE. So let's now have a group picture taking before we start the pep talk proper. Please show your face on the video. Gallery view. Okay, let's have a picture taking. One, two, three. Page 2. 1, ready? 1. Ipahabol. 1, 2, 3. So let's start. I have a patient empowerment program which would like to empower the lay people or patients to take control in the management of their health. What I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as priority. This is my key performance indicator. I hope you will be in my group of 30. I launched this pep talk on May 15, 2021 with the module on COVID-19. Second module was on patient empowerment. Third module was on patient management process. Fourth module was on rights in patient empowerment. And the fifth module, staying healthy and contented. There are 6 parts in this fifth module: introduction and intentional living plan, healthy lifestyle plan, screening and periodic health check, early diagnosis and early treatment, first aid and basic medical care, food supplements, are they necessary? Today's pep talk will be entitled First Aid and Basic Medical Care. The empowerment objective is for the lay people to have an understanding of first aid and basic medical care as parts of a patient empowerment program. One tactic to stay healthy or alive and not crippled as long as possible is to know how to do first aid and basic medical care for common medical emergencies. Common medical emergencies, if not properly and timely treated with first aid and basic medical care, may lead to disability and even death. So a person who aims to stay healthy or alive and not crippled as long as possible must know how to do first aid and basic medical care for common medical emergencies, especially those which are life and limb threatening. First aid is the first and immediate care provided for injury or illness with the following criteria. Immediately after it occurs, at the location where it occurred, often consists of one-time short-term treatment and requiring little technology or training to administer. So these are the criteria for first aid. The 3 P's of first aid consist of the following. Foremost is preserve life, prevent further injury, promote recovery. Basic medical care means care essential to maintain the health and safety needs of a person with goals to preserve life, prevent a health condition from worsening, and to promote recovery. First aid and basic medical care can be used synonymously. First aid is a more popular layman's term than basic medical care. But basic medical care is more encompassing than first aid. What will be included in this PEP talk are even those common medical emergencies which cannot be managed by a person himself because of loss of consciousness. Examples are the cardiopulmonary arrest and fainting. But having knowledge of first aid and basic medical care of the common emergencies in which a person, even if the person will not be able to manage himself because of unconsciousness, may still be helpful in staying alive and not crippled. He may and should be empowered to teach other people on what to do during emergencies. Teaching other people, especially those who are always around him, relatives, significant others, may save his life and limb when the people he has taught applied their know-how on him and when the need arises. Or before he completely becomes unconscious, he may coach them on what to do to save his life and limb. Also, what will be included in this PEP talk are what I think are the more common ones based on my experience. I may not be able to include all possible medical emergencies in the world as there are too many, but rest assured that I will refine my PEP talk in terms of addition and even subtraction if needed as I go along with my patient empowerment program. So let me resume, sorry for that. So these are the medical emergencies that will be expounded in this PEP talk: cardiopulmonary arrest, airway patency promotion, management of choking, fainting, splinting of fractures, bleeding in body surface wounds. I will just present the essential elements in each medical emergency. For details, please look up the internet, because there are a lot of write-ups and videos on this. Let's start with cardiopulmonary arrest. What and recognition, meaning diagnosis. Cardiopulmonary arrest is cessation, stoppage of heartbeat, or cardio, in that term, cardiopulmonary arrest, and respiration, cessation of respiration, the term pulmonary in the phrase. So recognition of cardiopulmonary arrest include the following: loss of consciousness, absence of breathing effort, and absence of pulse. Diagnosis as to the cause. Okay. So there are many possible causes of cardiopulmonary arrest. Okay. This can come primarily from the heart and lung diseases and secondary affectation to the heart and lungs. Okay. So the cause may not be evident at the time of the arrest, the cardiopulmonary arrest, and the cause may be evident or assumed in those with no clinical diseases prior to the arrest. First aid and basic medical care consists primarily of cardiopulmonary resuscitation. Do this only when there is no advance directive or no directive on no CPR. Okay, because if you do cardiopulmonary resuscitation with an advance directive, you may be liable for doing it. Okay. Patients who are terminally ill may have an advance directive on no more CPR when they develop cardiopulmonary arrest. The emergency life-saving actions include clearing the upper airway, repeated chest compressions, repeated mouth-to-mouth breathing. For the last one, I'd like to tell you that there is a version of CPR that does not require mouth-to-mouth resuscitation anymore. So first is the recognition of the cardiopulmonary arrest, then ask someone to call 911. We have a national hotline on this. And then 143, this is the Philippine National Red Cross. 117, Philippine National Police hotlines, or hotlines of nearby hospital with an ambulance facility. Then institute CPR right away. So first, clear the upper airway to ensure patency, like so. If there are some obstructing objects inside the mouth, scoop it out. Chest compression, this is for hands-only CPR, which you can easily do. Okay. Push down hard and fast in the center of the chest at the rate of 100 to 120 pushes a minute. 100 to 120 pushes a minute. Push down hard means about 2 inches below. Okay. Let the chest comes back to its normal position after push. The second type of cardiopulmonary resuscitation is the conventional one, especially being used by people who know how to do this, and also in the hospital or by the so-called emergency medical service team. Okay, so in the conventional CPR, mouth-to-mouth breathing is done. Okay, in combination with the chest compression. So the ratio is 30 chest compressions and 2 rescue breath. Okay, so as I said, this is not done in the hands-only CPR. Okay, so for you, I suggest that you just master the chest compression only, without the mouth-to-mouth resuscitation. The emergency life-saving actions are done until the person in cardiopulmonary arrest has been revived and has started breathing on his own, and are called off because of judgment of non-reversal already. So tapos na. Ibig sabihin, you cannot revive the patient anymore. Now let's go to airway patency promotion. Airway patency promotion refers to ensuring that the upper airway is not obstructed. The upper airway extends from the mouth to the trachea. It has an important role in transporting air to the lungs. Every person needs air to breathe and oxygen to survive. Obstructed upper airway can cause death. In all cases of medical emergency where first aid is needed, ensuring airway patency is the top priority. The A that you see in all popular emergency algorithm like ABC, ABCD stands for airway. It's always on the first, A. Okay. Promoting airway patency is done first before B, okay, and C for circulation. Check first whether the patient is breathing or not, breathing naturally or not. If not, check the face, mouth, and neck for anything that will make one suspect something is mechanically obstructing the upper airway. If yes, try to remedy the obstruction, such as releasing something that strangles the neck and removing or clearing objects in the mouth that is impeding the airflow into the lungs. If there is no object that is mechanically obstructing the upper airway, especially in unconscious patients, to prevent the relaxed tongue from falling back to obstruct the airway, one can do the so-called head tilt chin lift maneuver or the jaw thrust maneuver. In the head tilt chin lift maneuver, this is how you do it. Okay. One hand applies downward pressure to the patient's forehead. Okay. Tips of the index fingers of the second hand lift the mandible or the jaw at the chin, which lift the tongue from the posterior pharynx, from the throat. Okay. It tries to lift this tongue up. In the jaw thrust maneuver, it is done this way. The hands are placed on each side of the face with the fingertips at the angle of the jaw or the mandible, and then gently lift, okay, forward, upward, the jaw to open the airway. A jaw thrust and not the chin lift, head tilt chin lift, is done in patients with possible spinal cord injury on the neck. Next is choking, management of choking. Choking occurs when the foreign object lodges in the throat or windpipe, blocking the flow of air. In adults, a piece of food often is the culprit. In young children, often swallow small objects. Because choking cuts off oxygen to the brain, give first aid as quickly as possible. Recognition and diagnosis, the universal sign of choking in adults is hand clasped to the throat. Other early signs, inability to talk, difficulty breathing or noisy breathing, squeaky sounds when trying to breathe, cough, which may either be weak or forceful. First aid and basic medical care. If a person is able to cough forcefully, the person should keep on coughing. If he cannot, use the following techniques: abdominal thrust or the so-called Heimlich maneuver and back blows. This is how you do it for Heimlich maneuver. Okay. Stand behind the person, wrap your arms around the waist, tip the person forward slightly, make a fist with one hand, position it slightly above the person's navel, grasp the fist with the other hand, press hard into the abdomen with a quick upward thrust as if you're trying to lift up the person. Perform the abdominal thrust repeatedly until the blockage is dislodged. To perform abdominal thrust on yourself, there might not be around to help you. Place a fist slightly above your navel. Grasp your fist with the other hand. Shove your fist inward and upward. Or another alternative is to stand against a countertop chair, a desk, or sturdy chair. Press your upper belly firmly against its upper edge, grasping its sides with both hands. Thrust yourself forward vigorously, bending slightly at the waist, and repeat as needed until the object is dislodged. For back blows, stand to the side and just behind the choking adult. For a child, just kneel behind. Then place one arm across the person's chest for support. Bend the person over at the waist so that the upper body is parallel to the ground. Deliver separate back blows between the person's shoulder blade with the heel of your hand until the blockage is dislodged. Fainting. Fainting happens when you lose consciousness for a short amount of time because your brain isn't getting enough oxygen. The medical term for fainting is syncope, more commonly known as, in layman's term, passing out. Fainting spell generally lasts for a few seconds to a few minutes. Recognition and diagnosis. There is sudden loss of consciousness for a few seconds or few minutes, followed by a full return to full consciousness and functionality. Most have no serious health consequences, being caused by transient factors such as emotional shock, sight of blood, lack of food, dehydration, exhaustion, and standing up suddenly, and other causes. First aid and medical care. If you feel faint, lie down right away or sit down. To reduce the chance of fainting again, don't get up too quickly. Place your head between your knees if you sit down. If someone else faints, position the person on his or her back. If there are no injuries and the person is breathing, raise the person's legs above the heart level, about 1 foot up. Loosen belts, collars, and other constricted clothing. If someone else faints, to reduce the chance of fainting again, don't get the person up too quickly. If the person doesn't regain consciousness within 1 minute, a more serious underlying cause, and then manage it accordingly. Check for breathing. If the person is not breathing, begin cardiopulmonary resuscitation. If a person was injured in the fall associated with a faint, treat the bumps, bruises, or cuts appropriately. Control bleeding with direct pressure. Fractures. Fractures are broken bones. Any bone in the body can be fractured either by trauma or by disease. Recognition and diagnosis of fractures. The symptoms and signs of a fracture vary according to which bone is affected, as well as the type or severity of the fracture. Obvious or overt signs are angulation of the bony area and protrusion of broken bones through the skin. Overt and inconspicuous symptoms and signs are extreme pain and tenderness, with the patient being not able to move the affected part. First aid and common medical care. The most important thing to remember is never to move a patient with a suspected fracture. This may cause severe pain and may worsen the injury. Assess the patient rapidly for the type and severity of the fracture. Also check the inability to move the injured area or any sign of bleeding. When there is bleeding, apply pressure on the wound to prevent excessive blood loss. Immobilize the affected part with splints. Apply cold compress on the affected part. Wait for professional help to arrive. Splinting. It's the immobilization with any device, something sturdy, okay, like woods and sandbags. Okay. And then after you splint, check the distal pulse and skin color, okay, to make sure that there's a blood flow going on into the lower part of the extremities. For fracture in the neck and the spine, immobilize the neck with the use of sandbags or hard pillows like this. For fractures in the extremities, incorporates the joint above and below the fractures in the splint. For fractures in the forearm and hand, an arm sling with a triangular bandage can be used to immobilize the fracture. The last topic is on the bleeding in body surface wounds. What and recognition of body surface wound? So these are any breaks or disruptions on the skin up to the fatty and muscle layer, not including the bone and internal organs. Body surface wound can occur from head to toe. Diagnosis of body surface wound. Trauma is the usual cause, a common cause of wounds. There are different types of wounds depending on the cause and severity of the force or trauma. So you can have a cut, stab wound, bitten wound, chop wound, crush wound, okay, etc. The wounds may be mild, moderate, and severe. We classify wounds as mild if it is small area and very superficial. If it's severe, it's large and deep, and in between, we classify it as moderate. At the first sight of a wound, check for bleeding and rate of bleeding right away. If profuse, apply direct pressure on the wound. If not, wash it right away with water and soap and keep it clean with a bandage. I'd like to emphasize is to wash it right away with water. Do not just put a bandage on it, but clean it and then let it stay there for a long time before a professional help arrive. Clean it right away with soap and water. Determine whether there's a need to seek professional help. Okay. Example, need for suturing the wound, need for anti-tetanus injection, etc. And then determine whether there is a need for medications. So there you are. I presented the following 6 medical emergencies in this PEP talk: cardiopulmonary arrest, airway patency promotion, management of choking, fainting, splinting of fractures, bleeding in body surface wounds. Know how to do first aid and basic medical care for these 6 common medical emergencies. As a tactic for you to stay healthy or alive and not crippled as long as possible, to make you become more patient empowered. Maximize your knowledge, kaalaman. Maximize your capability, kakayanan. Lastly, maximize your self-determination, kapangyarihan in mastering and learning these and more medical emergencies, as this will redound to gaining greater control over decisions and actions affecting your health. The basic concept or the ultimate goal of patient empowerment. So with this, I'd like to end my PEP talk on first aid and basic medical care. I hope I have empowered you to have a better understanding of first aid and basic medical care as parts of a patient empowerment program. So before we go to the group picture taking, reminder, please take the online CUM evaluation test exercise for mastery of learning and have a perfect score to get a certificate. Okay. And then I'd like to announce also that the achievement day on the ROJoson PEP TALK core course will be on October 16. This will be a recognition day for those who have completed all the OLETE requirements of the core course by October 13. Shout out to these 14 who have completed all the OLETE requirements, including the 3 write-ups: Advanced Directive, Intentional Living Plan, and Healthy Lifestyle Plan. Rochelle de la Cruz, Rex Orentino, Beth Mambing, Christy Zara, Cora Hoson, Therese Hoson, Cecilia Cruz, Pide Caldino, Monica Lagos, Josephine Spiritu, Lolita Ramirez, Chris Nesesia, Gusta Polotan, and Redeem De Castro. Thank you for all your support. So let's now have a group picture taking before we start the QA and interactions. Please turn on your video now. Okay. Ready? All pictures. 1. Okay, pahabol. 1, 2, 1, 2, 3. Oh, wait. May pahabol. Let me start again. Let me start counting again. Last count. 1, 2, 3. Page 2. Let's have a page 2. 1, 2, 3. Okay. Give me 1 minute to save this. Okay. Any questions? Any questions that you want to ask? While waiting for the questions to come in, okay, I'd like to reinforce my lecture by doing some practical activities. So I know some of you have companions beside you in the room. Okay. As we know that respiratory efforts and pulse are very important indicators whether a person is in cardiopulmonary arrest or in respiratory difficulty. Okay, so I'd like to teach you some basic on how to determine the respiration and the pulse. Okay, so let's start with respiration. So for those who have companions in the room, okay, please look at your companions. I suppose they are breathing. Okay. Okay, because they're still alive. Okay, but take a look at how they breathe. Okay, for a short moment, and then, okay, then can you try to count? Can you try to count the respiratory effort? Use a stopwatch or timer, 30 seconds, 30-second timer. Okay, 30 seconds, then times 2 to get a respiratory rate of 1 minute. Okay. So in practice, in medical practice, we usually require a respiratory rate of 1 minute. So can you take a look at your companion and then try to count, and then can you put in your number in the chat box so that I can see whether somebody is in respiratory distress. And we start with
taking pulse sa kamay, Doc, or sa leeg.
Mamaya. Respiratory muna.
Respiratory, okay.
Respiratory muna, okay? So, for those who have companions lang naman, okay? So, put on the chat box the number. Put there, RR, respiratory rate equals how many?
Respiratory rate mo daw pala.
Equal how many per minute? Say 25 per minute, okay? Okay. Now for those who are alone, okay, especially I have determined the need to teach this in the time of pandemic because most of the patients are isolated. They are in the room, okay? So if they don't have pulse oximeter, I ask them to count the respiratory rate by themselves, okay? Nobody can count it for them because nobody is allowed inside the room, okay? So what I usually teach them is to put their hands, can you see it? Put their hands on the chest, okay, on the chest, and try to feel the breathing up and down, okay? Okay? Kasi mag-isa lang kayo di ba? Mag-isa lang, the person is by himself or herself, okay? So it's either he looks at the mirror or he feels his or her respiration. So with this one, 1, 2, 3,
20.
Mafe-feel ninyo. Okay? Okay, but do it naturally. Wag niyo exaggerate, no? Okay? So, okay? So for those who are inside the room right now alone, can you do it? Okay, put your hands on your chest and then try to count your respiration. Count it 30 seconds, then multiply it by 2 to get 1 minute. Okay? I'll give you 1 minute to do it. Kasama na ito sa practical test. Biro lang. Okay, Karina is 28. That's normal. Okay. So what is considered as red flag? When you have a respiratory rate of more than 30 per minute, 30. We all advise our patients who have COVID-19, when they have more than 30, no, that's a red flag. Okay, so they may need oxygen. So those who have 30 count, no, you can repeat it, no, baka overconscious lang kayo, no, okay. Okay, any question before we go to the next topic, which is pulse determination? So continue to do it there in your place now for the respiratory rate. No, okay. Now let's go to the pulse. Okay. There are two ways of getting the pulse. One is putting your 2 fingers on the wrist. The other one is through your neck. Okay, at the carotid area. Dito, sa lower part. No, okay. Usually we advise doing it on the wrist. It's the easiest. Okay. So put your 2 fingers below the thumb. Okay. And then try to feel for the pulsation. Okay. Try to feel for the pulsation. And then count 30 seconds again times 2. 1 minute. Okay, get it? So can you start counting? And then put down on the chat box. This time it's PR, pulse rate, pulse rate. Kanina RR, no? Respiratory rate. Ngayon it's PR. The range of the normal pulse rate is from 60 to 100. Okay, that's a normal range. If it's above 100, it's supposed to be fast. If it's below 60, it's considered as slow. Okay, but there are variations. No, there are exceptions to that normal rate. Some can have a heart rate or pulse rate of 40 and still be normal. These are people who are athletics. Okay, and then there are people who will get a pulse rate of 100, 110 when they are exercising. Okay, doing some hard work. So their pulse rate can be higher than 100. Okay. Any questions on the pulse rate and the heart rate? At least we have some practical exercise today, the minimum. Okay. So for Maria Hustapolotan, okay, pulse rate and heart rate determination gotten normal. Okay. So who has abnormal heart rate, pulse rate? Who has abnormal respiratory rate? Nobody, I hope. Walang may COVID ngayon. Okay. So any question now on the topic, the main topic?